Hello, this is Dr. Roger Elmer, Advanced Neurospinal Solutions, and what we're going to discuss right now is laser. And I don't know if I brought this into field. Let me check. This is a therapeutic laser, and we're going to discuss some of the applications and possibilities, basics. We're going to get much more in depth with it. And it's something that we use in order to particularly amplify the therapeutic effect of neuroplasticity. It proves to be a really fun tool. Most of the thing, well, almost just about everything that we use here is another tool in the foundation of causing the nervous system to adapt, to change. And there are many people who use laser. For them, it's more of a gadget or gimmick, or that they went to a seminar and that. But we use it from a physiological point of view. The concept of laser is that light has an impact on everything, right? And if the sunlight causes you to wake up better, causes you to stand better, move better, and it brightens up your emotions and all of that. Well, when light enters your eyes, it comes back to what's called the rods and cones. The rods and cones have rhodopsin in them. When the light hits the rhodopsin, it turns them up heavily. And it's because of that foundation of rhodopsin that the rods and cones can convert that information of the light wave frequencies into impulses that go back to the occipital lobe, and you interpret it as sight. Well, in every cell of your body you have rhodopsin, so we can turn up the cell from the inside before we ever do anything, or while we're doing it, which is really fun. And we're going to get into some more advanced concepts and uses of the laser, but today we're just discussing the real basics. How do we turn things on using the laser? In my process of working with patients in what I call therapeutic design, some of the things that I'm going to do is to turn on the blood flow to the area that we're working with, or the areas that we're working with. As we turn the blood flow up, then we're going to start working with areas that are around the area that has the problem. Like, let's say a speech area. Let's say somebody has a stroke and they can't speak. They had a stroke in the middle cerebral artery over here on the left side, and affected what we call Brocaw's area and that. And so I'm going to be working with all those areas around it to get it ready for the actual therapies, the speech therapies that we're going to do with the individual. Well, then we'll actually do the actual therapy, and there are even more advanced concepts related to that. Well, what we can do with the laser is we can use the laser we can actually aim it in the direction of the cells that we want to hit, and we can affect positively those cells and turn up their what we call their metabolic rate, steps them up. It's kind of like the old engines, the trains where they'd shovel coal. They'd shovel coal in, and the more coal they shoveled, the hotter it got. Therefore, the better the steam and the faster they went. Well, it's the same thing here. We can turn the area up, and so we can target specific areas. We can target the brainstem through the mouth or underneath. We can get the top of the brainstem, the mesencephalon and the pons, or we can get the medulla from down below. We can get the orbitofrontal cortex by getting through the nose. The dorsolateral prefrontal cortex we can get by aiming it. And here's the prefrontal and frontal. By knowing those areas, we can target those areas and turn them up. And as we turn them up, turn those cells up, they're ready to do what we ask them to do. Now we're going to get into much more advanced therapeutic processes. We have a lot of fun with this thing. We get some pretty gnarly cases people with brain degeneration, traumatic brain injuries, strokes, kids with autism and dyslexias and that. All of those, and they say, well, will it work with it? Well, it works with cells. If you got cells, it'll work. Now, does that mean we'll see a difference right off the bat? Not every case, but we will see that I'm able to work with the patient and push those cells harder so that we can get more done, which is really, really fun. So if you have any questions, we're going to be doing some more advanced videos on laser, and give some explanations and that on it. If you're interested in learning more, we have our brain workshop on Wednesday nights starting at 7 o'clock, and sometimes we actually pull the laser out and work with it and discuss it and that. But let us know if there's anything that we can do for you. If you have any questions, call our office, 702-798-1112, and ask a question, and I'll do a video on the answer to that question, and then we'll send you the link. So let us know when you're ready to take your life back.